The crisis assessment response team that deployed as of January 1st, 2018, and that rolled out as a result of the Crisis Process Improvement Initiative, something that started before me, and that was a partnership with the Sheriff's Office, North Central Healthcare Center, who's the mental health provider here in our community. Really, it came around with in how we were handling mental health crisis and the resulting number of hospitalizations or commitments of people for emergency detention. There's a financial aspect to that, but then there's also the human aspect to that, which is what is in the best interest of those people who are in mental health crisis and what in the best interest of the patient. So everyone together came to the realization that we can handle these differently, and we need to divert more people from being hospitalized and providing more resources to stay in place in their home and safety plan with them. First and foremost, in the best interest of that patient towards their mental health and preventing future crisis, but also from a cost perspective of what it costs in the commitment process and hospitalizing a person. So those three agencies got together and all agreed to put some resources forth in terms of staff. So now the Crisis Assessment Response Team formed as one of those initiatives out of that process, and it has one officer from Wausau PD, one deputy from the Marathon County Sheriff's Office, and they're each partnered with a crisis professional from the healthcare facility. That allows us, the Sheriff's Office, and our partner at the healthcare center to be much more effective in mental health response. So not only responding reactively to people in crisis, but also going out and knowing those people in our community who are struggling ongoing and helping them make it to the next day, the next week, the next month without having to go into the hospital, without having to have a traumatic experience of uniformed officers showing up at their house and having to have a ride in a squad car and be hospitalized. Effectively better their lives and quality of life, but also reduce the need for active police response and hospitalization for mental health crisis.